Great, so I think we are ready to begin. Once again, if anyone is having any issues with the audio, please type into the chat box and we will assist with that. But it does seem that people are able to hear, which is excellent. Welcome to Asthma Canada's Speaker Series webinars. Our 2019 webinar series has been made possible through educational grants from AstraZeneca and GSK. This will be our last webinar in our 2019 series, and today we'll be speaking about managing asthma in older adults. This is an increasingly important topic for Asthma Canada and for our community, and I know many of you are looking forward to it, so thank you very much for joining us. My name is Jenna Reynolds. I'm the Director of Programs and Services at Asthma Canada, and I'll be moderating today. Before we begin, I'd like to go over some quick housekeeping rules. Please note the webinar is being recorded, and we will upload to our website after. All attendees are muted, but at any point, if you have any questions, comments, any issues, please type into the chat box, which I'll be monitoring throughout. There's also a little blue question mark at the top of your screen. Feel free to type in any questions you have there. There will be a Q&A at the end, but please make sure to type in any questions you have as we move throughout the presentation, and we will get to them at that point. Very quickly, I'd like to highlight some of our work. Asthma Canada is the only national organization solely dedicated to helping all Canadians affected by asthma. We are committed to improving the lives of the Canadian asthma community through education, support services, research, and advocacy. Our work centers on the missing gaps within the healthcare system, mainly through providing education and support for patients and their families, both in print and online. We also advocate to the Canadian government on improving health outcomes for people living with asthma. Our current focus is on national pharmacare, or access to medications, for fair, equitable, and universal coverage across the country. And of course, we also support research into better health outcomes and the eventual cure for asthma. We have a national research program which supports graduate-level students studying early or late onset asthma. You can visit asthma.ca for more information. And much of the work we do is through our community of volunteers and members across the country. People living with asthma, families, parents, caregivers, healthcare professionals, educators, and others who are strongly committed to improving asthma care and the quality of life. The Asthma Canada Member Alliance, ACMA, is a free membership of Canadians who engage in all the work we do and who provide support and input into our initiative. If you have not already joined us, I would certainly welcome you to become a member at asthma.ca/join. And now I'd like to introduce our distinguished presenters, Dr. Renette Barthelette and Dr. Cheryl Sadowski. Dr. Barthelette has practiced pharmacy for over 30 years in hospital, community, and primary care settings in Alberta, British Columbia, and Saskatchewan. For the last 6 years, she has been an instructor at the University of Alberta. Dr. Sadowski is a professor at the Faculty of Pharmacy and Pharmaceutical Sciences at the University of Alberta. She's a clinical practice in geriatrics and in an interprofessional geriatric outpatient clinic at the Misericordia Community Hospital in Edmonton, Alberta. Thank you both. It's a pleasure to have you with us, and thank you for everyone attending. And now I'll be happy to pass over the presentation to you.
Thanks, Jenna. Great. Well, welcome. This is Cheryl. I'm pleased to be part of this presentation today and share some of my knowledge and experience of working with geriatrics for the last 25 years.
And I'm Renette, and I thank you for joining us today and for asking us to give this presentation. We're quite happy to be here and from chilly Edmonton. So a quick overview of what we'd like to talk about for the next 40 minutes or so. We'll quickly do an overview of asthma, signs and symptoms. We'd like to spend a bit more time on talking about the management of asthma. As we're pharmacists, we do like to talk about medications, but we will touch on some other management strategies and also a little bit about other medical conditions and how that can affect your asthma. And at the end, as we're pharmacists, we'd like to provide you with a few tips from us. So just to talk a bit about signs and symptoms and diagnosis of asthma. Asthma can start at any age. It's considered to be a chronic disease that can be managed, but it can go into remission. And when I talk about remission, I mean that symptoms may go away and they may or may not come back again. Often children that develop asthma may go into remission, but asthma may come back later on in life. Or you can be diagnosed with asthma later in life. it's some of the symptoms that you might expect to see if you've been diagnosed with asthma is you may have regular coughing, and it's more often seen at night or the early morning. You may have some wheezing, which is a whistling sound that comes from the airways that makes it a little bit difficult to breathe. And you may have shortness of breath where you can't breathe well enough, you can't get air into your lungs. And you may or may not have some tight chest feeling, heaviness or pressure in your chest. And some people, not all people, may experience some increased mucus production. So what does well-managed asthma look like? Well, based on some of the description of the symptoms that I just gave you, we would expect that you would have no nighttime asthma symptoms, so no coughing or waking up in the night. We would expect that you would have symptoms less than 4 times per week. And sort of hand in hand with that is that you would not need to really use your reliever medications more than 4 times per week. That you would be able to exercise with no symptoms, and you would not be missing activities such as volunteer work, going to work, social activities, or recreational activities because of your asthma. So asthma management, again, we as pharmacists do like to talk about prescription medications, but we would like to talk about asthma management as an overall strategy, as there is just not one thing that people should consider in managing their asthma. You need to look at your lifestyle, vaccinations, educations, and having an action plan, and we'll touch on these things today. Very, very important that you talk to your healthcare provider if you have any questions about your asthma management and treatment. Asthma Canada has produced a lovely brochure about living well with asthma, especially in older adults, so I highly recommend that to you for more information. So if you are experiencing symptoms outside of what I described, your asthma would be considered to be poorly controlled. So why is that? So there are many reasons that you may be experiencing asthma symptoms. So one of them may be not taking your asthma medications as prescribed. For example, not using it regularly as if it's prescribed to be taken regularly. Maybe not using the right asthma medication for you. Maybe the inhaler isn't being used correctly, which is, we'll talk more about inhalers. Perhaps you've been exposed to a trigger or have a condition that's causing additional breathing problems. And also potentially an incorrect diagnosis. So again, important to talk to your healthcare provider if your asthma is not well controlled. So common asthma medications. So the first class of medications that pharmacists like to refer to are controllers. They're also known as preventers. And this class of medication is known as corticosteroids, often referred to as steroids. They're usually delivered as an inhaled medication, and it is the best, most effective prescribed medication for management of asthma. How this medication works is it acts over a period of time to reduce inflammation in the airways. So if you look at the picture there, you can see that on the inflamed airway picture, that yellow circle inside the airway is an area of inflammation. And with regular use of your controller medication, you'll see that the inflammation is reduced. Oftentimes when using your corticosteroid medication, you may not feel different because it does not open the airway as reliever medications do, which we'll talk about in a minute. It does not stop bronchospasms. Common side effects that someone may experience with inhaled corticosteroids is yeast infection in the mouth, also known as thrush, where you get white spots on your tongue or in your mouth. And one way to avoid that is to rinse your mouth after using your inhaled corticosteroid. The other common asthma medication is often referred to as a reliever or a rescue medication. And these medications are what we call short-acting bronchodilators because they open the airways. They dilate and open the airways. The short-acting medications work fairly quickly, within 10 to 15 minutes, but they don't last very long, about 4 hours. So if you have asthma, every person should have a reliever medication, and potentially maybe even more than one. You might want one in your purse or in your bag or in the car, just so that you have one when you need one. This medication does not reduce inflammation. As you can see from the picture, it opens the airways, but when the muscles are relaxed in that picture, you can still see the inflammation in the airway. Common side effects that are associated with these short-acting bronchodilators include shaky hands, nervousness, and maybe a bit of a fast heartbeat. Again, because these medications are inhaled, side effects aren't as pronounced as they would be if you were taking a medication orally. Other common asthma medications can be these two medications in a combination, so combination inhalers. They include an inhaled corticosteroid plus a longer-acting bronchodilator. Longer-acting bronchodilators do the same thing as the short-acting ones. It's just that they last a bit longer, so you don't need to use the medication as frequently. So they can last 12 to 24 hours, depending on the medication in the combination product. They must always be used in combination with an inhaled corticosteroid. If you have asthma, you should not be using a long-acting bronchodilator by itself. It should always be with an inhaled corticosteroid. There's two different kinds of long-acting bronchodilators. One is called a long-acting beta agonist, or LABA, and it's a long-acting version of the rescue medication that's in the blue inhaler, and I'll talk about that more in a minute. The other ones are called long-acting muscarinic antagonists. I know these are big words, or a LAMA. These are more commonly seen in patients with COPD than in asthma, but they may be used in asthma occasionally as well. Some of the side effects with the LAMA medications, because they're slightly different than the LABA ones, are dry mouth and difficulty urinating. Another important aspect about treating your asthma, it's not just about the medications, but we also need to think about the inhalers that are being used to deliver those medications directly to the lung. So there are many different kinds of inhalers. So in the picture, you can see the blue one. That's our blue rescue inhaler, and it's what we call a metered dose inhaler, and it delivers a spray of the medication into the lungs. The purple one is a discus type inhaler. The one in the middle with the little blue at the bottom, little turn dial, that's the Turbuhaler. And the one to the far left, it's blue and white, and that's called an Ellipta. Those bottom three medications deliver medications in a powder form. There are other inhalers that may be used in asthma, but are more commonly used in patients that have COPD. There's, on the far left, there's a Respimat, which is a spray. The two in the middle are breathehalers or handyhalers, where a capsule is put into the device and the capsule is broken and the powder is inhaled. And the one on the far right is a medication that delivers a powder to the lungs as well. Something that I would like to point out is that there are many different options for inhaler devices. So some devices may be better suited for you than others. And if one does not work, something else might. So just this grid that I put up on the slide, I know it's relating to patients that have COPD, but some of the issues can also affect patients with asthma, where they may have weaker hands. You may have difficulty manipulating an inhaler. And on the slide, it talks about stronger lungs. And what we mean about that is to inhale some in the devices where it's a powder, the patient needs to be able to take a quick and forceful breath in order to get the powder into the lungs. So often that's associated with COPD, but that may be that difficulty to inhale quickly and forcefully may be associated with other medical conditions as well.
Great, thank you, Renette. I want to talk a little bit about how some of our health conditions affect how we use inhalers. We have information from the Canadian Survey on Disability. This is conducted every 5 or so years in Canada, so this is some of the most recent findings that we have. We do know that as people get older, they do have more difficulties with function and with their abilities, and you can see over the age of 75, about 43% of older adults will have some form of disability. Some of these disabilities do impact how we use our inhalers, how strong our grip is, or how we can coordinate our breathing. There's a number of studies that have looked at how older adults are using inhalers, and this is one very interesting study that was published a few years ago. So this is a clinical trial where they looked at people across the lifespan, people with asthma, and were observing how they used their inhalers. There was a number of steps to properly use the inhaler, and they had about equal amounts of children and adults. What's interesting is based on the age groups, there were different mistakes that occurred. So in children, they were not breathing out properly before they did their inhalation, and then older adults were also having difficulty with the breathing process, but failing to exhale fully. Now, what do you think would be the percentage of patients who completely followed all of the steps and used the medication correctly? Well, this might surprise you. When we look at children, they actually did better with their inhalers. The correct technique was used about 3/4 of the time. In older adults, we're seeing that that's far less. And in fact, very few individuals over the age of 75 were able to follow all of the steps correctly. But this points out even younger adults might have difficulty. So if you're having a lot of difficulty with your inhalers, this is normal. It's something that we actually expect, that it's something that you have to learn and practice. What we do know is that inhalers are more difficult than people think. There's actually quite a few steps involved. So I've shown you one research study, but there's actually quite a few studies. And we know that across adults, about 50 to 70% of people will actually have difficulty using inhalers. There was also a recent study looking at physicians, and about half of them could not use the inhalers correctly. Now, to be fair, they didn't necessarily have asthma, but they're writing prescriptions and recommending asthma medications for people. We know from research that about 1 week after receiving your inhaler, about 10% will not be able to use it at all. We know that inhalers require a lot of coordination, so you actually have to have good vision to maybe insert a capsule or to turn a device or open it properly, maybe read the labeling. You have to coordinate it with your hands, and there could be some stiffness, maybe some arthritis, and then coordinating your breathing and also thinking through all of those steps. It's actually a very challenging task. It's also something that takes a lot of practice. So we don't expect people to know right away how to use that inhaler. And maybe you're on different types, or maybe you have switched. So there's some new techniques that you'll need to use. We also want to point out that you need to see it done, which often happens when you pick up your prescription, but you don't always get a chance to demonstrate. And so that's helpful to refresh your technique. So when you first get the inhaler, actually practice using it. Use it in front of a healthcare professional, and then each time you pick up a refill or talk with your family physician or a specialist to bring your inhalers in and show them how you're using it so they can correct if there's any mistakes. The Global Initiative for Asthma, this is sometimes referred to as GINA. So this is an international guide, and they set expectations for how we should be treating asthma internationally. So this gives us some guidance on how we would choose a particular device for a particular person. So we know there's quite a few different steroid inhalers, so we have to think about which device works for that person with their other conditions, with their vision, with their hand strength, etc. It's important that it's checked at every opportunity, so that means every office visit and every time you go to the pharmacy. You should expect this from your healthcare professional. And if they forget, it's important to ask, can I show you how I use my inhaler? Can you confirm that this is working okay for me? Can you give me some feedback? You should be asking this if they forget. And also, it's important health professionals do know how to properly follow all of these steps and how to use one inhaler before or after another, so they should also be able to demonstrate that for you. So we hope that you appreciate that GINA is supporting that this is a team process. You have to work with your health professional, but we also have high expectations for them as well.
So one other thing that's available for patients with asthma who have metered dose inhalers is that you can use a spacer device. A spacer device is a tube that you stick the inhaler, metered dose inhaler, the blue one, or similar to those, on one end of the spacer device, and the medication goes into the tube, and then you can breathe it from the other end of the tube. It helps for patients who have difficulty coordinating or difficulty breathing. Asthma Canada recommends that anyone of any age who is using a metered dose puffer or inhaler should consider using a spacer. It does help for better delivery of the medication in the lungs. If you have a metered dose inhaler and you think this might be good for you, please ask your pharmacist, respiratory therapist, physician, certified respiratory educator about the best device for you. There are several different types of spacer devices available. There are other prescription medications for asthma. These typically are not inhaled medications. One of them are called leukotriene antagonists. These are more commonly used in asthma patients that have allergies, more commonly seen in pediatrics, but that doesn't mean they're not used in older adults. They aren't as effective as the corticosteroids, just so that you know that, and they're an oral tablet. Theophylline used to be used quite frequently, but we actually don't use it very much anymore, but there are still some patients who have prescriptions for theophylline. And this is an oral bronchodilator, and again, when we take medications orally, there tends to be more side effects that go along with that. Because it's related to caffeine, it can cause some jitteriness and perhaps some sleeplessness. Biologics are quite new on in the area of many different diseases, but also for asthma. We typically see these used more for allergy-type asthma and a class of asthma called eosinophilic asthma. So it's a very sort of special subset of patients with asthma. Biologics are typically given in an injectable format. Other management strategies, moving on from drugs, are vaccinations. So depending on what province you're in, the pharmacist may help you with these. There's two that we wanted to point out today, and that is your influenza vaccination. Older adults and persons with chronic conditions like asthma are more at risk for complications of the flu. So please, we really encourage you to have your flu shot every year. The other vaccination is the pneumococcal pneumonia vaccination. So there are a couple of different types, and it's best to talk to your healthcare provider about which one is best for you. Other management strategies are about things that just happen every day in your life. So as somebody with asthma, you should try to think about what are the triggers in your life that set off your asthma. Here in Alberta, these past few summers, we've had a lot of forest fires. You might have heard about that. And we've seen an increase in number of patients that are having difficulty with respiratory conditions such as asthma and COPD. Other triggers for some people can be allergic, like animals, exposure to molds or pollen. And other triggers can be non-allergic. Some people's asthma can be triggered by an intense emotion or being anxious or worried. And I already mentioned about the weather and the smoke. And some people's asthma is exacerbated by exercising, which moves into my next point about activity. We suggest that you talk to your doctor about what your level of activity should be for you. And if your asthma is limiting your ability to be active, as per your discussions with your doctor, then your asthma is not being well controlled. And then go back to think about those points that we brought about earlier. So why is it not being well controlled? And then the other bullet about managing your asthma, and very important for anybody that has asthma, is to have an action plan. So do you have an action plan? Do you know what to do when you have an asthma attack or it starts to become uncontrolled? Everyone with asthma should have an action plan because it helps to identify early warning signs and what to do if your asthma is starting to get worse, so that perhaps interventions can happen sooner before you may move into a full-blown asthma attack. I printed out on the side here one example of an action plan from Asthma Canada. There are many different ones, but typically they all have like the green section of what your asthma looks like when it's well controlled, the yellow section when it's getting worse, and it's personalized for you about what you should do when your symptoms start to get worse. And it also has a red section of what to do when your asthma is starting to fall into that full-blown asthma attack. So again, talk to your healthcare professional about creating one that's tailored just for you. A question that we get is, oh, I'm feeling better now. Can I just stop taking my medication? So this is a decision that's unique for everybody, and it really depends on what triggers your asthma. It depends on your environment. It depends on other health conditions you might have. Again, it's a chronic disease where you have inflammation in the airway, so it's important that inflammation is managed. It's really important to talk to your healthcare professional about adjusting or reducing the dose of your medications. It's important that you do not stop your controller medication without talking to your doctor. It's that medication that keeps that airway inflammation in check, even though you might feel better. The asthma guidelines recommend that even patients with mild asthma should remain on an inhaled corticosteroid, even though it may be at a lower dose. Another question that we sometimes get is, can I have asthma and COPD, or chronic obstructive pulmonary disease? Well, actually, this is not that uncommon. According to the GINA report, that they state approximately 15 to 20% of patients have been diagnosed with asthma and COPD. They have a name for it now. It's called ACO, or Asthma COPD Overlap Syndrome. And this can be quite challenging to diagnose and to treat. So whether you're diagnosed with asthma or diagnosed with COPD or both, it's really important that spirometry testing is done to determine what type of airway disease that you have. Each of these diseases has their individual guidelines for treating asthma, which is the GINA guidelines that we've talked about, and the COPD has its own guidelines for managing COPD.
Because these are two different diseases, you are going to see different guidelines and different medications used. The emphasis in asthma is on reducing that inflammation, and so it emphasizes the importance of your steroid inhalers. For COPD, inflammation isn't as much of a concern, and the focus is on opening up those airways. This is a picture from two pharmacy students who are doing a medication review for an older adult. These are medications that were found in this individual's home, and you can see there's quite an inventory here. So we wanted to highlight how difficult it's becoming as people use more and more medications and the complexity associated with people's regimens. So you might feel that your medication list is getting longer and longer, and that can be difficult to manage. It can also be expensive, but there's also a number of interactions that can occur with that. We wanted to highlight a few medical conditions that you might have or might be at risk of, and you had not realized that that can be impacting your asthma. For example, reflux, which we sometimes call heartburn, or as a disease, you might have heard the term GERD, gastroesophageal reflux disease. Sometimes we're not very careful about treating this, or you might only use medication now and then. That's actually a condition that can be worsening your asthma. So when we talk about how is your asthma controlled, your pharmacist and physician might also ask you about how these other conditions are being controlled as well. Having sinus problems, seasonal or chronic, will affect your asthma. Obstructive sleep apnea is being diagnosed more frequently and is also associated with obesity. Both of these conditions can aggravate asthma. Infections, primarily pulmonary infections or sinus infections, but even other conditions like ear infections or infections in other parts of your body can affect your well-being and control of your asthma as well. And Renette has already mentioned that anxiety and emotion can trigger your asthma. Some medications that you may be taking or might take in the future could be affecting asthma as well. If you already have asthma and you're started on a medication for dementia or for Alzheimer's disease, an example here is donepezil or Aricept, that's something that could cause a little bit of constriction in your airways, and it might affect how you're feeling or how you're breathing. Medications that are used for high blood pressure, there's some examples here. We call them beta blockers. An example is metoprolol. These types of medications can also lead to poorer control of asthma. Over-the-counter medications like aspirin or anti-inflammatory drugs like ibuprofen or Advil or Motrin, these can also worsen asthma. So it's important, anytime you start a new medication, it's important to ask, how does this affect my asthma? Will this interact with that condition or with the inhalers that I'm taking? In order to make some decisions about people who have multiple conditions and on a number of medications, it's important that you emphasize your preferences. So we actually have some guidance from the American Geriatric Society. When working with older adults that have multiple conditions and multiple medications, it can be really hard to navigate. So the number one priority is your concerns. What are your priorities? What would you like to address? How do you envision your asthma being controlled? Because older adults are using more and more medications, we have research every few years at from the Canadian Institute of Health Information. So this is a national group, and they collect information from all the provinces and territories. So we get a sense of how many medications seniors are using. We know that seniors represent just a fraction of the population. So currently it's about 17%, but they're using, in some cases, the majority of medications. through public health plans. So on average, a senior in Canada will be taking about 7 medications. So that includes all types of medications. It can be over-the-counter, prescription, inhaler, etc. But 7 medications is actually quite a few. That can be challenging to manage. With so many medications and other conditions to worry about, it can be easy to forget to take medication. We know this is common in every age group, but the more medications you take, the more difficult it can be to manage. Some of the causes is we're just busy and we forget. It's not intentional, it's just a mistake. Sometimes people are confused about the regimen. Should they take it all the time? Which one should they take first? And also, when should you take it in relation to some of your oral medications? Some people have a little bit of a denial situation. When you take your medication, it reminds you you have a disease. And some people don't want to be reminded, so they purposely don't take their medications. Sometimes people are afraid of side effects. I appreciate, as a pharmacist, sometimes those printouts that you receive from the pharmacy can be overwhelming. And if you look online or listen to the commercials, it can seem like there's no end of side effects. So it's important to admit that maybe you're afraid that some of these things could be harmful to you. There can also be stigma. Maybe people think if you're using an inhaler, maybe you're a smoker, or maybe you're not very active, or maybe you're just embarrassed to use something that's this complex out in public. So people choose not to use their inhalers then if someone's going to see them. And we have to acknowledge that some of these medications are fairly expensive, or maybe you're living in a setting where you don't have coverage for the cost of all of your medications. All of these can contribute to you maybe not taking your medications every day as they're scheduled. But we do want to encourage you that there's ways that this can be addressed. If you're feeling overwhelmed with your regimen, it's important to talk with your healthcare professional. There could be something that's an easier regimen. Maybe some of your oral medications can be reduced or changed, or maybe there's an easier inhaler to use. There's some inhalers that only are taken once or twice a day, so you can take the medication more privately. Or maybe given the setting that you're in, you need some advice on how to do that in a private way so people aren't watching you. There are long lists of side effects, but that's a complete list from the drug companies. And so that's every possible side effect that could ever happen. Some side effects are more common than others, so it's important to understand which ones are more likely, which ones could affect you, and then also approaches to reduce the side effects. For example, with a steroid inhaler, it's very simple to rinse your mouth afterward, after you take that dose. So you rinse out that powder and prevent having an infection. That's a very simple way and can be adopted into your routine once or twice a day. There's also a variety of costs, and usually newer medications are more expensive, and newer medications aren't covered right away by the drug plans. So it's important to ask about other options that are available to you that might be just as effective. You can also set up reminders with your schedule. If a medication is to be taken once a day or twice a day, maybe it's helpful to put it by your toothbrush in the bathroom where you brush your teeth once or twice a day, or by another where you would pick up your cell phone, or by your bedside. Whatever works in your routine for something that you do regularly, you can set up your inhaler devices to act as reminders as well. There's also quite a few apps that you can have on your smartphone that will help you track control of your asthma. There's reminders that you can set up physically, sort of like a Post-it note, but you can set them on your phone as well. So it reminds you at certain times to take your medication. And sometimes people record how their disease is controlled, the type of activity they do, the symptoms that they have. And it's helpful when you're filling that in. That reminds you each day and helps you record when you took your medication.
So we'd like to share just a few tips from us as pharmacists. We would like to encourage you to make an appointment to see your pharmacist and review your asthma medication. So some things for you to do in planning for a meeting with your pharmacist would be to bring your medications with you. And this means all your medications, your prescription medications, the inhalers, topical, spacer devices, all your non-prescription medications, including vitamins, supplements, and herbals, and any devices that you might be using to help you remember to take your medications, for example, a blister pack or a dosette. We also encourage you to bring somebody with you, like a family member or a caregiver. And it's always good to have two sets of ears hearing information. Before you come to the appointment, write out your questions and bring them with you, and bring a pen and paper and write down the responses so that you remember. If you have a lot of questions, sometimes it's hard to remember all the answers. So it's good to write the responses down so you can remember it to look at it later. And you can ask to have a written report or a handout or recommendations from the pharmacist when you're talking to them, so you can take that home with you. It's okay, it's good to remember that over time our abilities change, so it's important that we acknowledge that we may need to have reassessments over time. With respect to talking to your pharmacist about your asthma management, write down and bring with you how often you have been using your rescue inhaler over the last weeks and months. This is an indicator, again, on how well controlled your asthma is. Some people like to keep a diary to monitor their asthma control, and there's just a picture there of one example of an asthma diary. Things that you might want to keep track of are activities that you've missed, how many times you might wake because of your asthma symptoms, how frequently you're experiencing symptoms and using your inhaler. Bring your action plan with you if you have one, and if you don't have one, make sure you add that to your list of things to address with your pharmacist. It's also important to schedule regular doctor's appointments so that you can have conversations with your doctor as well. Again, we're a team to help you manage your asthma. And if your pharmacist asks you to show you how to use your inhalers, please do. They're just wanting to make sure that all is well and that you're able to use the device and it's the right device for you. Another question that we get are questions about travel tips. So we wanted to include a few travel tips for you. So before you leave, think about potential asthma triggers on the airplane, at your destination. Is there lots of smog or pollen in the place that you're going? So again, before you leave, it's important to use your controller as prescribed and have your rescue medication on hand. When you're traveling, make sure you have enough of your prescription medications with you. So not just for the time of your trip, but make sure you have enough in case you get delayed and have to stay at your destination longer than expected. It's important to keep your medications, not just your asthma medications, but all your medications, on your person, so in your carry-on, on your carry-on bag, because if you put it in your luggage and it's stored in the plane, if it gets lost, that would not be good. And it's also important to have a list of medications and your conditions with you as well on your person. Bring your action plan so you know what to do if you run into difficulties. Make sure you have some travel insurance. Make sure your vaccinations are up to date. So before you go to places, make sure that you've investigated what vaccinations you need to have aside from your influenza and flu shots, your influenza and pneumococcal pneumonia shots. And nowadays with the internet, if you have access to that, you could research in advance some hospital or other healthcare centers in the area that you're visiting to. Note the address and contact information.
We hope as we've come to the end of our presentation, that we've encouraged you to have high expectations for your healthcare professionals. Of course, they're busy, but you should expect that they're interacting and supporting your priorities to care for your asthma. We want to make sure that you, everyone that's on this call at the end, reviews their asthma action plan or starts to take steps to put an asthma action plan together. This is required no matter what age you are. You should be getting regular medical care and talking about your asthma at each visit, keeping in mind that your other conditions can be affecting your asthma. We, as pharmacists, want to encourage you to be sure to understand your medications, take your medications, and talk about them if you are having any difficulties. Vaccinations are important as well. These can be through your pharmacy or through other sources in your community. And we want to end by reminding you that you are empowered to direct your own care for your asthma and to have high expectations. One way you can educate yourself is with the new Living Well with Asthma guide that has come out from Asthma Canada. This is available free of charge on the website, and it gives you a little bit more detail about some of the items that we've talked about today in this presentation. We want to thank Asthma Canada for supporting this presentation, and we'd like to thank the sponsors for their contributions to making this presentation take place, and we thank you for your participation and your attendance today on a Friday afternoon.
Thank you.
Excellent. Thank you both very much. That was very informative and detailed. We have a few questions that came out of the chat box, but again, for everyone, now is the time to ask any of those questions. So if you write them, we'll make sure to get to them. First, from Stacy, what about a patient with severe arthritis whom cannot dispense an MDI? Is there any aids to help people like that?
Severe arthritis, so that would be a situation where it's very difficult to grip the inhalers. Sometimes there are special contraptions that you can arrange through the pharmacy to go onto the device that help sponge down the inhaler if you need to use a metered dose inhaler. We sometimes find individuals with arthritis find it easier to use something like a discus. And I'm not sure, Jenna, if we're able to go back to the pictures of the slides. Is it okay if we scan back to that slide?
Yes, feel free. It might take a couple of minutes.
Okay. So we had an example of a discus early in the presentation. So this is the purple device. It's actually designed quite well ergonomically. So you can slide it open quite easily. You don't have to bend or use your fingers too much. And so this is a device that works well. And the Ellipta can also be, it depends really. We usually like to test the different devices. So you can ask at the clinic or at the pharmacy if there's sort of dummy inhalers or placebo inhalers, and one might be easier for you than another.
Great, thank you. From Lynn, this was briefly mentioned, but she does ask, what role do immunizations play in managing asthma, particularly for older adults?
Immunizations as in?
As in vaccinations for example, influenza, pneumococcal pneumonia.
For people that have asthma or any chronic condition, if they experience, if they get the flu or they get pneumonia, because you have a risk like a medical condition like asthma or another chronic condition, that puts you at greater risk for more complications as a result of getting influenza or pneumonia. So that's the reason why we really encourage patients who have chronic things like COPD or asthma or other medical conditions to get their immunizations, like the flu shot, like the pneumococcal pneumonia shot, to reduce their risk of getting these things, so that because if they do, they are at more risk for being much sicker if they do get it, with more complications.
We do know that if people with asthma have a lung infection, such as flu or a pneumonia, they're more likely to be hospitalized and have a difficult course during that hospitalization. So there's more complications that can happen in hospital, and more likely to have acute, what we call acute bronchospasm, so very sudden and more difficult to control. So likely more hospital visits, more ER visits because of those infections. And so that's why we would like to prevent those infections from occurring. And we do know the vaccinations reduce that risk close to about 60%.
Thank you. This is a question that actually comes from two people, Judy and Alice. Is prednisone prescribed for uncontrolled asthma, and what are some of the side effects of long-term use of prednisone? Alice specifically says that my doctor told me that I have weakened and loosening of my muscles.
So ideally we like patients to have their asthma managed, but sometimes patients will have an exacerbation or a flare-up to various extents. Some they may be mild, moderate, or severe flare-up. So if your asthma is not being controlled by your inhaled corticosteroid and you have a flare-up, then yes, you will be put on an oral. You might get it, if you're in the hospital, you might get an intravenous corticosteroid because they need it to work quickly, or you could get an oral corticosteroid like prednisone because there's a lot of inflammation happening, and prednisone is the drug that they would typically use orally to manage that inflammation. And typically with an acute flare-up like that, they would use prednisone, but not for an extended period of time. Typically, it might be a week or so until that inflammation is under control, and until you can go back and continue to use your inhaled corticosteroids. The reason we like to use the inhaled corticosteroids is because the drug is being delivered directly to the lungs, so there are fewer side effects. With oral prednisone, because it's taken as an oral tablet, yes, there are more side effects. Some of those side effects would be expected with short-term use. Sometimes you might get an upset stomach. We like to suggest you take it with food. Some people, if you might make them have some insomnia or a bit restless, so we suggest you take the prednisone like once a day in the morning so that that's not a problem. So yes, there are some side effects. There are tips and suggestions to help mitigate those side effects. Typically, we don't like to see prednisone used as a long-term management. Oftentimes, the dose will be tapered down for a few reasons. One, to make sure the asthma is not going to flare up again. If you tape down the anti-inflammatory too quickly, then the asthma might flare up again. So we want to make sure that the asthma is being controlled over time, and augment that with the inhaled steroid as you're tapering down the oral prednisone. And also that a long-term prednisone can affect your body in other ways as well. So you don't want to reduce it too quickly if you've been on it for a long time. But typically with asthma, it's a short course of prednisone that's used. With respect to long-term side effects, again, we try to avoid long-term prednisone use to avoid those long-term side effects. There may be some effect on the bone, like especially with long-term oral use, where the bone density might be, your bones may be less dense or a little bit more fragile. So that's one thing we were very careful about with oral corticosteroids. With inhaled corticosteroids, typically we don't see the same type of effects to the whole body as we do when prednisone or steroids are given orally. So if you're using an inhaled corticosteroid over a long period of time, you need to use an awful lot of inhaled corticosteroid over a long period of time before you might see some of these side effects, such as osteoporosis. And then it's a discussion that it's important to have with your doctor, because you need to weigh the risks and the benefits of maybe a bit of osteoporosis and managing that versus the risk of having a severe asthma attack, which can be very severe and can be life-threatening too for some people.
Thank you. From Carrie, my mother is elderly and I'm caring for her more and more. What can I do to make sure her asthma is managed, as well as trying to care for everything else for her?
That's a good question, because sometimes as caregivers it can be overwhelming. You have a lot of things that you're considering, and so we do want to acknowledge the important role that caregivers play. In terms of managing the asthma, it can actually be challenging as the caregiver if you're helping to hold up a device for someone. It's very difficult, even just giving the medicine to yourself. When you hold up the inhaler and try to coordinate puffing it, inhaling it, but it's even harder if you're doing it for someone else and you try to coordinate how you're pressing it and how they're breathing it in. And so we suggest if you're physically helping someone use their inhalers, it might be good to talk with the pharmacist or physician about using a product that allows you to use a spacer. That's the easiest thing when you're giving a medicine to someone. It's also important to maybe have an entire medication review. We encourage this with the pharmacist because there might be other ways that you can decrease the complexity of that regimen, or to simplify things so it's a little bit less overwhelming. So those are very good points. I would suggest trying to look at a spacer or practice with different devices that are easier to use.
Great, thank you. From Judy, can you go into withdrawal if you wean off a corticosteroid too quickly? What happens and what should you do?
If you stop a steroid too quickly, that is a concern if it's in your bloodstream. So that would be if there's an oral medicine or if you received an injection of steroid medicine for quite a few days. Usually we would say after 1 to 2 weeks of using an oral medicine, an oral steroid, we might start to slowly decrease it over a number of days. Usually it is possible to stop your inhaled steroid. There might be a reason because you're switching to something else, having a surgery or some kind of test that you might have to hold it for a bit. And with the inhalers, you don't get that same withdrawal effect. But what we are concerned with is that it can leave your asthma uncontrolled. So you would have to be very careful working with your healthcare providers about stopping your inhaler medicine. So it may be you're stopping it because you now have a different diagnosis, or they corrected the diagnosis and you no longer have asthma. Then you can look at just stopping your inhaled steroid.
Great, thank you. From Tasha, can you comment on how ibuprofen might worsen or exacerbate asthma?
There's a small percentage of people who have what we call aspirin-induced asthma because they have an allergy to aspirin. So it's not everybody that has asthma may experience this, but there are some people who that is their trigger. Just like some people's trigger may be pollen, some people may trigger may be cat or animal dander. For some people, their asthma trigger may be aspirin, and ibuprofen is in that same class of medications as asthma. So that's why we sort of flag that as something to be aware of.
It doesn't happen in everyone, so we would point out that sometimes people with asthma are able to take these anti-inflammatory medicines. They are able to they've tried it before, it doesn't have any effect. But we just pointed out that some people might have a pretty significant reaction, and so to talk with your healthcare professional before you try that, or to try one of those medicines when you're in a setting where you could get medical care. You can also be tested for an allergic response, so you can also talk with your physician about allergy testing, for example.
Great, thank you very much. We are at the end of our time, so we will be ending here. We definitely appreciate you taking the time to give us this presentation, and for everyone that joined us and asked questions. If you have benefited from our webinar series and would like to see similar programming, please consider making a donation at asthma.ca/donate. Also, if at any point you have any further questions, please email us at info@asthma.ca and we'll be happy to help. We also have a bilingual asthma and allergy helpline, which connects Canadians with a certified respiratory educator for information and support. You can reach our toll-free line at 1-866-787-4050 or email info@asthma.ca. Thank you everyone so much and have a great weekend.